Hello everyone, and welcome back. Today we're beginning our exploration of hypnotherapy in trauma treatment, and in this first lecture, we're going to lay the groundwork by asking a simple but important question. What is hypnotherapy? Now, when most people hear the word hypnosis, they think of something mysterious, maybe even a little theatrical. Stage hypnotists making people cluck like chickens, or TV shows where a pocket watch swings back and forth until someone falls into a trance. But in clinical psychology, hypnosis is nothing like that. The term itself comes from the Greek word hypnos, which means sleep. But hypnosis is not sleep at all. In fact, it's almost the opposite. Hypnosis is a state of aroused, attentive, and focused concentration. Think of it as being deeply absorbed in one single experience while the rest of the world fades into the background. It's like those times you've been so engrossed in a book or a movie that you barely notice someone calling your name. Dissociation and suggestibility. One of the key features of hypnosis is dissociation. Under the guidance of a trained therapist, a person can separate certain thoughts, sensations, or even memories from ordinary awareness. This isn't a loss of control, it's a shift in focus that allows the mind to tune into something very specific while tuning out distractions. Along with dissociation comes suggestibility. During hypnosis, people become more responsive to helpful suggestions. That doesn't mean they'll do whatever they're told. That's a common myth. Instead, they become more open to imagining new possibilities, feeling different sensations, or experimenting with behaviors that might normally feel out of reach. Importantly, clients retain control. They can always reject suggestions that don't align with their values or goals. What actually happens in a session? So what does a hypnotherapy session look like? Typically, the therapist begins with an induction, a guided process, often using relaxation or visualization, to help the client enter a trance-like state. This trance is not sleep, but a focused awareness that feels calm and safe. From there, the therapist introduces tailored suggestions. For example, a person with chronic pain may be guided to imagine the pain fading or changing its quality. A person with severe anxiety might be led to picture a safe place where calmness grows stronger. Someone with trauma might be gently encouraged to revisit an experience, but with new emotional resources available. This is why hypnosis is sometimes called a state of enhanced imagination. The mind is focused inward, allowing the client to experience things in new and powerful ways. Integration with other therapies. It's also important to emphasize that hypnotherapy is usually not a standalone treatment. Most clinicians use it as a tool integrated into other approaches, such as cognitive behavioral therapy, dialectical behavior therapy, or talk therapy. Some see hypnosis as a therapy in its own right, while others treat it as an enhancer that makes other interventions more effective. Think of it this way. CBT might give a person the tools to challenge negative thoughts, but hypnotherapy can create the deep focus needed to absorb those tools more fully. Clinical applications. In practice, hypnotherapy has been used across a surprisingly wide range of conditions. Psychological conditions, anxiety, depression, phobias, panic attacks, and of course, post-traumatic stress disorder. Physical conditions, irritable bowel syndrome, chronic pain, migraines, tinnitus, and sleep disorders. Behavioral issues, smoking cessation, weight loss, habit change. Sessions are highly personalized, and many therapists also provide recordings so that clients can continue practicing at home. Controversies and limitations. But like any therapy, hypnosis is not without its controversies. One of the biggest concerns involves the suggestive nature of hypnosis. Because people in trance are less likely to critically analyze suggestions, there have been cases where clients reported recovering repressed memories under hypnosis, memories that later turned out to be false. This is why the skill and ethics of the therapist are absolutely essential. A careless or biased practitioner can do real harm. Another limitation is that not everyone is equally hypnotizable. Responsiveness to hypnosis falls along a spectrum. Some people enter deep trance easily, while others hardly respond at all. And finally, there are certain groups, such as individuals experiencing psychosis or hallucinations, for whom hypnosis is not appropriate. Key takeaways. So, to summarize, hypnosis is not sleep, but a state of focused awareness and absorption. Its core features include dissociation and suggestibility, but clients remain in control. A hypnotherapy session typically involves induction, tailored suggestions, and integration with the client's therapeutic goals. It is often used alongside other therapies, not as a replacement. It has a wide range of applications, psychological, physical, and behavioral, but it also comes with limitations and ethical considerations. That's our foundation. In the next lecture, we'll step back and look at the historical roots and modern definitions of hypnosis, tracing how theorists and clinicians have debated what it really is and how that impacts our practice today.